Hello guys, welcome back to my channel. Today we learn about a talk which was released in 2019, which is on multiple sclerosis and pregnancy. So a lady with multiple sclerosis, if she got pregnant, then what are the things, what are the drugs, if she's planning to get pregnant, what are the drugs we need to stop, all those things. Okay, generally the female population has more chance of having multiple sclerosis, almost twice as males. Females have chance of having multiple sclerosis. Okay, so females have twice risk. Okay, so multiple sclerosis is something like a chronic inflammatory demyelinating disorder of central nervous system. So in the central nervous system, the nerves have demyelinating disorders. Okay, so obviously the neurological symptoms you can get, and also the neurological symptoms can be progressive, dysfunction and disability. Okay, most of the people will have this kind of multiple sclerosis. Most people can have this kind of multiple sclerosis, that is RRMS. Okay, what is RRMS? RRMS is relapse remitting multiple sclerosis. Other types are secondary progressive multiple sclerosis, primary progressive multiple sclerosis. Okay, so these are different symptoms, like which I already told, neurological symptoms are present. Okay, so if a patient with fatigue, urinary retention, numbness, loss of balance, dizziness, visual problems, acute chronic pain, constipation, spasticity, okay, cognitive symptoms, mood changes, these are present, then you can suspect multiple sclerosis. And least common like dysarthria, dysphonia, dysphasia, seizures, tremors, breathing problems, itching, headache, hearing loss. These are seen like least common. These are seen. The primary symptoms are these: very fatigue, there is a loss of balance, there is pain, there is optic neuritis as well. Secondary symptoms are because of complications of primary symptoms. So there is recurrent UTI because there is your urinary incontinence. As there is urinary incontinence, so there can be um, recurrent UTI. Okay, and poor alignment and trunk control will be there because loss of balance. There will be poor trunk control. Bone density will be decreased. Inefficient breathing can also occur. Okay. So basically, in pregnancy, the interleukin 10 value amount will be reduced, which results in exacerbation of symptoms. Okay. Uh, yeah. So in pregnancy, it will increase because pregnancy results in more of interleukin 10. Coming to maternal effect, there is maternal effect. Okay. So high frequency of volume, see, high frequency of voluntary childlessness will be there, and many more will choose to terminate the pregnancy. If there are multiple sclerosis, become pregnant, most they choose to terminate. Fetal effect is also seen. Risk of FGR is present, almost 1.7, almost 2 times nearly. FGR is present in case of multiple sclerosis. Pre-pregnancy counseling is very important. So, what are the drugs we need to stop? Because interferon beta is a treatment for multiple sclerosis. So, if they want to conceive, they need to stop after conception. Once they got pregnant, they need to stop. Okay. They do not cross. These do not cross placental barrier, but and there is also no increase of risk of congenital abnormalities. All, but after conceiving, we need to stop because it is in pregnancy and breastfeeding. It is contraindicated. Other drug is glatiramir acetate. This also we should stop after consumption. This also does not cross. But this is a category B drug. Steroids, possible effect is there. Okay, and we know if steroids are used, there is gestational diabetes, preterm rupture of membranes, and preterm delivery. Natalizumab is stopped before conception. Even teriflunomide will stop before conception. Alemtuzumab will stop before conception. Okay, so basically these drugs which I am telling you again, I'll repeat: interferon beta, glatiramir acetate, steroids, natalizumab, teriflunomide, alemtuzumab. These are all stopped before conception. See these drugs, fingolimide. Fing, it's sounding like wing. So 2 months before we'll stop this drug. 2 months before conception. Coming to mitoxantrone, mito will decrease nipping the ovarian reserve, so it reduces the ovarian reserve, and it is stopped before 6 months. Methotrexate is stopped before 6 months. It is a teratogenic and embryotoxic. Mycophenolate mofetil is stopped before almost 6 weeks. Okay, so remaining other like dimethyl fumarate, cladarbine, these are stopped after 6 months. Even ocrelizumab is stopped after 6 months. So remember like this, fingolimide 2 weeks, so 2 months before will stop. Mitoxantrone will stop after before 6 months, and methotrexate will stop after 6 months. Mycophenolate mofetil is a very big word, but it's only 6 weeks. Remember that. Cigarette smoking will increase the progressive age of multiple sclerosis. And yeah, bladder symptoms may worsen during pregnancy. That we should know. Okay. And it is very uncommon for women with multiple sclerosis to give steroids for more than 4 weeks before birth. But they will need additional oral or parenteral hydrocortisone during delivery. So prednisolone giving is not that common, but during delivery, hydrocortisone they will be giving itself. Okay. And in labor and delivery also, you should ensure the bladder is empty or not because of neurological problems. Okay. And it is advisable to have a indwelling catheter. This is a very important question. So multiple sclerosis patient, they have indwelling catheter. They should keep indwelling catheter. Okay. Breastfeeding, they can continue. And people say that if that you are taking multiple sclerosis drugs, breastfeeding should be done after 4 hours after taking intake of drug. Okay. Multiple sclerosis increases with ART, artificial reproductive technology. If they are used to conceive, then mainly GnRH agonists, the multiple sclerosis can increase. Okay. And almost sevenfold in exacerbation of multiple sclerosis is seen. Okay. That's about multiple sclerosis in pregnancy. So I want to repeat once whatever we read now. Okay. Okay. So multiple sclerosis in pregnancy. So multiple sclerosis is a chronic inflammatory neurological disorder which is affecting the central nervous system. So there is a demyelinating nerves. So it results in neurological symptoms. Okay. So almost 2 times females have more chance of getting multiple sclerosis. There are types like simple progressing, okay, or relapsing. Okay, recurrent relapsing is most common. So symptoms, if coming to symptoms, there is loss of balance, there is numbness, there is chronic pain, acute pain. Okay, there is optic neuritis. Um, yeah, there is retention, urinary retention. These are all primary symptoms. Dysarthria, dysphagia, dysgeusia. These are all secondary, less common symptoms. Okay. These symptoms are seen, and if the patient is there, then you should do MRI and diagnose multiple sclerosis. And in multiple sclerosis, generally we'll give treatment, and if that lady is want to conceive, trying to conceive, then we should stop few drugs. For example, fingolimide is stopped before 2 months of conception, and methoxantrone is stopped after at least before 6 months of conception. Methoxantrone actually reduces the ovarian reserve, so we should stop before 6 months. Then methotrexate is stopped before 6 months. It is a teratogenic and embryotoxin drug. And you have mycophenolate mofetil. It is stopped at least 6 weeks before conception. So these are different drugs we should stop before conception. Coming to yeah, uh, during labor, generally giving prednisolone and all, it's not that recommended. But during labor, hydrocortisone is given during delivery. Yeah, breastfeeding can be done, and people says that like after intake of drug, after 4 hours of intake of drug, better go for breastfeeding because within 4 hours the drug can go pass through breastfeed to the baby. Yeah, this is about multiple sclerosis. Thank you. We'll meet in next video. Bye.